So, this question is a little tricky because each hospital or EMS system may define an MCI by number of patients. So, for your hospital, 5 patients may be the definition. However, in general, an MCI, which stands for multi or mass casualty incident, is defined as an incident which overwhelms standard response capabilities. And this can vary depending on what resources you might have available. For example, if there's a car accident with 4 injured patients that all need to go to the hospital in an urban setting where several ambulances are available and there might be 2 trauma centers nearby, this would unlikely be called an MCI. There's no change in practice, no need for outside assistance. However, if that same accident occurred in a rural setting where maybe only 1 ambulance is readily available, this might be an MCI. This overwhelms their available resources. They'll have to start considering triage, who goes first. They likely have a plan in place for something like this, and they have to activate systems to get them the support that they need. There's a shift in how they care for patients from a normal patient-provider situation to focusing now on doing the greatest good for the greatest amount of people. This is essentially disaster medicine. When we start practicing medicine in a resource poor setting, we must start thinking differently. We must consider things like triage and how we could best use our limited resources to do the greatest good, save the most lives. This can be in a drawn out disaster, as we witnessed during COVID, or in a short disaster like an explosion or a mass shooting. And you'll learn more about this shift, the changes in practice that occur, and how you can best prepare your patients and your practice for disasters in the rest of this module and the modules to come. But before we move on to the rest of the case, I also want to point out that although most healthcare systems have detailed disaster plans in place, many that are practiced frequently and well tested, they may not always consider children in these plans. Remember that some of the specific resources we need to treat children may be different, and if we don't prepare for disasters by also preparing for disasters involving children, we are not fully preparing. Children make up 25% of the population and are consistently involved in disasters that affect our communities. As pediatricians, it's our responsibility to make sure children are considered in things like hospital MCI plans, crisis standards of care, patient surge plans, and more, which you'll learn about in the future. So in this case, our pediatrician is in a community hospital. An MCI has occurred and they've called all pediatric providers down to the emergency department. Let's continue watching to see how it plays out.